All right, good afternoon. Excuse me, I'm Sheriff Mike Williams. I'm here today with our Fire Chief, Keith Powers, State Attorney Melissa Nelson, our partners from the U.S. Attorney's Office and the DEA to provide you with some information about our shared efforts to combat the opioid crisis here in Jacksonville. Councilman Ron Salem is also joining us today, and he is representing the city's Project Save Lives program. So since 2018, the Jacksonville Sheriff's Office Narcotics Unit has had a dedicated team of investigators working solely to identify sources of narcotics, specifically heroin and fentanyl, related to overdose deaths in our community. Since then, our detectives have been called to respond to and investigate 440 of those overdose deaths. It is our practice to have narcotics and homicide detectives respond to all overdose-determined deaths together. And this force multiplier of investigative techniques helps to piece together the scene to attempt to identify the person responsible for selling or providing the drugs that caused the death of the victim. Detectives then coordinate these lengthy investigations with our partners at DEA, the U.S. Attorney's Office, and the State Attorney's Office. As the cases develop, a number of substantial charges can be identified, and those include but are not limited to the sale of narcotics, manufacturing narcotics, and up to including murder. Since the overdose death resulted from the premeditated sale and supply of those narcotics, that action holds that person responsible and liable for the resulting death, which can result in the murder charge. So the narcotics homicide investigative teams worked 263 of those cases in 2019, which was up from just 177 in 2018. That for us is a 65% increase in the number of those cases that we worked. So to date, 5 suspects have been indicted and arrested for murder in separate cases. In addition, our teams have arrested another 20 people on separate drug charges, and probable cause to indict for murder still exists and is being developed on other cases as well as we speak. So while today we're solely talking about law enforcement's approach to hold these people accountable for the deaths, it's important to get the message out to everyone about the risk involved in the use of illegal narcotics of any kind. And so we need to address this problem as a community and a nation to get the people the help they need and obviously save lives in the process. So we're seeing positive impacts from efforts such as Project Save Lives, which partnered with area emergency rooms to streamline services for those in need. And we encourage the community to join us in this effort and share information about the sale or use of illegal drugs by calling us at 630-0500, by emailing us at jsocrimetips@jacksheriff.org, or as always, to remain anonymous, work through our partners at Crime Stoppers, and you can reach Crime Stoppers at 1-866-845-TIPS. So with that, I will turn it over to State Attorney Nelson.
Thank you. Thank you, Sheriff. The opioid epidemic facing our city is similar to the one playing out in communities all across our nation. Overdoses, particularly those involving fentanyl, are killing people, and they're leaving families and loved ones devastated. Each of the 3 grand jury indictments that we're announcing today involve sale of heroin, and not just sale of heroin, but sale of heroin that was cut with fentanyl. These indictments send an important message to drug dealers, those who sell fentanyl and those who sell drugs cut with fentanyl, which lead to death, will be held accountable, not merely for the sale of the drugs, but for murder. The Florida legislature recognized this when they amended the law in 2018 to hold accountable such drug dealers. This is, as the sheriff said, the enforcement component of addressing this community-shaping crisis. Obviously, prevention and intervention strategies are as equally as important as enforcement strategies. But in order for us to be successful in the courtroom and to see successful prosecutions, the investigation has to act more quickly than the news of the death. And so I want to commend our law enforcement partners, JSO Narcotics, DEA, and obviously our first responders and JFRD, who are the boots on the ground who make the beginnings of what can become successful prosecutions, which we've seen in the federal courtrooms for some time. So specifically, I want to thank Sheriff Williams and JSO for their efforts on this front. These prosecutions, I want to make clear, do not change the Good Samaritan law, which provides immunity from prosecution for those seeking medical intervention, and that is important for the public to know. We still want people to call when they are in need. However, for those who cover up drug overdoses and those who deal in drugs that cause death, we will be aggressive on this front. We have been, and we want the public to know we will continue to be. At the State Attorney's Office, we've dedicated specific resources in the form of a single paralegal and 3 assistant state attorneys to work with our law enforcement partners and prosecute these cases throughout the Fourth Circuit. This issue is important to us, all of us up here, and it's very important to our community. So we will continue, I want the public to know, to use the tools available to us in the enforcement arena to address this epidemic and impact this crisis.
Great, thank you. And just to echo, I do want to take a minute and thank our narcotics detectives and obviously our partners at DEA. Without their expertise, we wouldn't be where we are today. And as Melissa mentioned, 3 recent indictments, 5 total, 3 recent indictments for murder in overdose deaths. So again, thank you guys for all your help. We appreciate it. So with that, I've asked Keith Powers, the fire chief, just to give a quick snapshot of numbers. We both saw an increase last year. He obviously is dealing with overdoses in general, but even those that don't obviously result in death. And so Keith's got some numbers to share as well. Keith?
Thank you, Sheriff. Just a couple quick numbers for you to tell you how serious this crisis is. We saw a 45% increase from 2018 to 2019 in suspected opioid overdoses. That resulted in, from January 1st to October 24th of 2019, and that's the latest numbers we have right now, that resulted in 320 deaths in this community. If you project that out, that projects out to over 1 a day through the end of the year. That's an absolute tragedy that's going on in our community. To give you an example of how many patients we treated in 2019, we treated 3,665 people for opioid overdoses. So the men and women for the Jacksonville Fire and Rescue Department are out there every day trying to save lives, but in some cases they're going back to the same patient 3 times in 1 day that is in respiratory arrest. They have quit breathing. We treat them. They go to the hospital, come home, use the drug again. We treat them again. They go to the hospital, come home, and it happens again. And that's a crisis. So I want to thank the sheriff and the state attorney and, of course, our federal partners that are actively and aggressively pursuing the people that are putting these drugs on the street.
Great, thanks, Keith. So with that, we can answer a few questions.
Do you have the names of the victims?
Do we have the names of all 300 and some odd victims?
No, the ones for the indictments.
We do. We have packets for you. We'll get you the information.
And then for the 20 other people that you said were also arrested, what's the
Correct.
Variation of crimes for that?
So anything, again, ranging from sale of narcotics, delivery of narcotics, that type of thing. So.
With Project Save Lives, I know it's been out for about 2 years now since it initially launched. I know you took it over from Gulliford. So as far as the effective rate, I know once people decide to go into PSL, that it's typically very successful. Can you talk about the expansion of this program because there is still a need?
Sure. Approximately 50% of the people approached in the ER go into treatment. We've had about around 1,400 that have been approached by one of our caretakers in the ERs, and roughly 700 have gone into treatment. We're in the process. We have now signed on UF Health, and we will be going into UF Health here in the near future. Contracts are being finalized, and we're hoping to get into every ER in this community over a period of time. That's the goal.
How many hospitals are you at now?
We're in 5
5
ERs.
Thank you.
Okay?
Great, and I think that highlights the complexity of this issue. This is a treatment-based issue. That's where the solution lies. And so, hats off to the city and the city council and Councilman Salem for continuing that Project Save Lives program. So,
Sheriff, I know that people don't necessarily talk about the opioid epidemic as much, but if you could say anything to the public to help them understand the severity of the situation because it is still happening.
I'll tell you one thing that I get an opportunity to speak to a lot of people in the community. And this may sound silly to some, but I can tell you that one message that we really want to push and drive is that heroin is not a recreational drug. The use of any narcotics is highly dangerous today. Anything you buy on the street, you don't know what you're buying. You may think you're buying one thing and you may be getting something else. And with the introduction of fentanyl as being as prevalent as it is in the underworld of narcotics. You just never know what you're getting, and every time you use illegal drugs, you're taking your life into your hands. And so now is the time more than ever to seek treatment if you need it. And again, we have those pathways available for people to do that. So, all right, thank you so much. We appreciate it.